Hi everyone, I'm Alex Halatic Bueno. We are here for Answers for Families, Eczema, Acne, and more. I'm here with two dermatologists from Boston Children's Hospital, Jen Tan and Sophie Delano. We're so happy you're here. We're going to be answering some questions over the next 30 minutes or so. And welcome, we're happy you're here.
Thanks for having us.
Yes, thank you so much.
We're going to start, with eczema. Can you give some insights on it? What is it? I know that's one of the big questions we've been asked.
Sure, and definitely this is the time of year to talk about eczema or atopic dermatitis, as we like to call it in dermatology. We give things lots of different names. So eczema is a sensitivity that someone has on their skin. Over time, this sensitivity can lead to areas that are coming up on the skin that are red, often very itchy, cracked, sometimes scaly, really tender, and uncomfortable. It can come and go from time to time, and it can pop up in different spots of the body as well.
And why does it happen? Is it genetic?
That's a very good question, and it's something that we're still trying to figure out in dermatology. There are a lot of different reasons why one individual person may develop eczema. These reasons can be genetic. We know that if you have any brothers or sisters or parents who have eczema, that you're at increased risk of having eczema. Also, if family members have had other diseases that are similar sensitivity diseases we think of, they often come together. Things like asthma, seasonal allergies, food allergies. Having family members with those also increases your risk of having eczema. So genetic, big one there. We also know that the skin is meant to be a barrier. It's protecting everything that's on the inside, stopping from what's outside coming in.
Yeah.
So in eczema, the skin is fundamentally not acting like a good barrier. I often tell my patients it's a little bit like a leaky roof. More things are coming through that shouldn't be. Things that might be irritating, things you might develop allergies to. And because of that leaky roof, you can imagine the child's immune system, or an adult when they have eczema, is going to be on constant alert, just always there to monitor for this. And sometimes will become overactive and send signs of we should respond to this area. And that's what turns and makes the skin red, swollen, itchy, and uncomfortable. That immunological overreaction, dysregulation that we can see in eczema. So it's genetic, it's barrier, it's the immune system, and it can also be environmental. We definitely know that eczema skin is more sensitive to things that other non-eczema skin may not be. Clothes, soaps, things out in the environment, fragrances, pollens, things like that. And also it could just be environmental, but a subset of that could be meteorological. If you live in a nice warm climate, not Boston in January, you may not have symptoms related to eczema. There may be enough moisture in the air to help your skin maintain that barrier. You take that same skin, transplant it in dry, cold New England, you may develop symptoms of eczema. So it can a wide variety. There's not usually one thing that we can say is triggering eczema. There can be lots of different things that cause it. So often when we have these first meetings with patients and their families, we're going through a whole lot of different things, and we'll be talking more about those, of different things that could be impacting their eczema and what they could be doing.
That's really interesting. I love the idea of a leaky roof. It's a great way to describe it. I think it makes it very clear sort of what's going on there. How long does it typically last?
That's a very good question. And we definitely see there are a lot of different flavors of eczema. There can be the one starting off really young, like the first year or two of life. We call it infantile atopic dermatitis, baby eczema. And often that can wax and wane, and that can be associated with some other condition like food allergies, food sensitivities. But some of those patients will improve after the first few years of life. And often we can see that they may not be as severe, they may be more responsive, and we can see them getting better through. And again, everybody's a little bit different, so your child's experience may vary, but we can see them getting better in those first few years of life. There can be other individuals that may have more severe eczema, that it becomes more chronic. So it's something that they continue to deal with in elementary school, high school, and as an adult. So it really can vary. And in both those types of eczema, the more chronic and the more infantile, it can come and go. I also describe it, we talk about leaky roof for the barrier, and the whole experience of having eczema is a roller coaster. It can flare when you're not expecting it. There can be some other triggers that we can talk about, like stress, those seasonal changes, vacations. That's a different one, like the environmental changes, using new products, like in a hotel. And also like doing it with vaccines, illnesses, anything that's triggering the immune system can also cause a flare.
That's so interesting. You said vacations. That's not something I would have thought about necessarily. So that's fascinating. Do you have, what are your tips that you tell patients for easing their symptoms?
Well, as we're thinking about, there are lots of different things that can be triggering this. I usually think about it as like I'm laying out like a big list, a large recipe. And I tell parents, you're going to pick and choose, and we're going to try to find the few things that work for you. So I never want someone to feel like, yes, I have to change these 20 things in my life right now. It's making small incremental change that I think is important. And they all go to protecting that barrier and removing potential irritants, allergens. So by protecting the barrier, we think of things like bland moisturizers. Moisturizers that can help seal in that barrier, that can help add in moisture. Often we talk about doing this, say, like after a bath, when your skin is still a little bit damp, and it can just be a good time to add that moisturizer in. A thing to think about, especially in our older patients, is that, a 13, 14-year-old isn't going to want to go to school with thick moisturizer all over their skin and feel coated, like they're a turkey ready for Thanksgiving. That I do like the thicker moisturizers in general, but if someone feels uncomfortable and isn't willing to use those moisturizers, then definitely use like the lighter weight creams, the pumpable lotions. There are even spray-on moisturizers if someone really doesn't like the sensation of things on their skin. So there's a wide range. The best moisturizer is going to be something that someone can use every day. So moisturizing, bathing is also crucial. By the time folks have come in to see us, they've often got lots of different recommendations for how often should my child be bathing, anywhere from multiple times a day to once a week. I tend to fall along the lines of you want to try daily or every other day, because it's a good way to wash off those potential irritants, to use that moist skin to put on the moisturizer again. So that's my recommendation, bathing once a day or every other day for that. So moisturizers, bathing. With bathing, this is going to sound crazy, and it often gets the raised eyebrows in clinics, but something that can really help with skin, it can be a home treatment, you can start it now, is actually making your bathtub a little bit like a swimming pool by adding bleach.
Interesting.
Yes. So this is a derm tip, like straight from the laundry section of the grocery store.
Fascinating.
And it's a small amount, so we're not dunking people in bleach.
Yeah.
If you're doing an adult-sized tub, for about half the amount, like several inches, enough you can sit in, be up to your waist, we would put in a quarter of a baking cup, or 60 milliliters.
Okay.
If someone at home has those small plastic measuring cups that come with children's like pain relieving medications, like acetaminophen or ibuprofen, those are about 30 milliliters each.
Okay.
So you can use 2 of those small little cups, mark it with an X, or put some duct tape around it. So remember, it's your bleach cup now, and into the bath. And it's safe. I have patients who are young as like 2 months old doing bleach baths. It's okay if it splashes in your eyes, or splashes in the eyes or the mouth. Like, knock on wood, we have never had a bleach bath emergency come through the Boston Children's emergency room. Hope never to.
Yeah.
So it's very safe. We recommend this for a lot of our patients. And studies have shown that the bleach, just being exposed to it, can really help calm down all of that overactive immune system I was talking about before. Those signals that, the skin is going to be sending to your brain, like, okay, get red here, scratch here, I'm really irritated here, like, this is going to feel uncomfortable. And that helps to stop those. And it's a great way. You're not using extra prescription medicine. Anyone can do it. It's completely safe. So I love bleach baths. I know it sounds a little crazy, but it's very safe and helpful.
I feel like parents are going to be really interested to hear that. You said it would raise eyebrows. I was thinking, wow, I can't believe that, but fascinating. So, you you've maybe gone through these home remedies and your child still has eczema. When is like a good time to come see one of you to see a dermatologist?
I think, well, first of all, I would always bring it up with the pediatrician, the family doc you may be seeing, whoever's your child's primary care, because they treat their, our colleagues in the eczema wars, that they treat a lot of eczema and they're very good at it to start. So I would bring it up at like your well child visit or have an urgent visit to start there, because often they can help with the first steps. And we do a lot of the same treatments. Like we go through and we talk about, okay, let's make sure that we're not using any fragrance products in the laundry detergent, dryer sheets, things like that. Let's make sure we don't have fragrances in the home, air sprays, plug-ins, candles, things like that. Even for small babies, this can sound odd, but small babies like to snuggle so much against the skin. If you're spraying on perfume or cologne onto your chest and you're snuggling a cute little eczematous baby, that can also be affecting their skin as well. So, from both pediatrician and from us, we'll talk about removing all of those irritants. And it may start on prescription medications, often topical steroids. There's a wide range of strength of topical steroids, and often we start at the lower end and try to work our way up to see what do we need to really help calm down the skin and give this child relief from their itch and discomfort.
That's awesome. Thank you. I think that was really, really enlightening. And Dr. Tan, we're going to ask you a few questions about acne. First of all, let's dispel the myths. What is acne?
That's a great question. Acne is the medical term for pimples.
Okay.
And I imagine that a number of our guests today have personal experience with acne or have a loved one who's struggling with acne, as 40 to 50 million Americans are affected annually by this condition. And in our young individuals, like age 12 to 24, up to 85% or beyond can experience acne.
Wow.
And as there's been a shift in recent years of seeing early onset puberty, we're actually also seeing a rise in the number of pre-adolescent acne. So this includes children aged 7 to 11.
Wow.
And acne is a disorder of what we call the pilosebaceous unit. And what that is the hair follicle and oil gland, which live together, typically in harmony. And their job is to create oil, which is to help to lubricate our skin and to keep our skin from drying out. And in folks who have acne, their pilosebaceous unit is on overdrive. So it's overproducing oil that can cause your hair follicle to become clogged or sticky. Bacteria can get stuck there too. And that's all influenced by our hormones, our genetics, and our own inflammation. And this can also be driven by stress, can actually make it worse. Mechanical trauma to the skin can cause acne to get worse, to become worse. And then finally, there is probably a dietary association as well. High sugars and foods that increase our glycemic load are thought to make acne worse. And in some adolescents also dairy and possibly whey protein. And acne in general, has a pretty large impact psychosocially on our patients. And so I'm really glad that we're talking about it today.
Absolutely. What are your helpful tips that you recommend for people experiencing acne, maybe particularly teenagers? You're talking about that psychosocial part too.
Yeah, that's a great question. I think that one thing to think about is, as Sophie had mentioned, there's many flavors of eczema. There's also flavors of acne, right? And there's different types of acne that we clinically see on the skin. And then there's also flavors or types of patient populations that are affected. So there's some acne that affects really young kids, including infantile and neonatal acne. There's also hormonal acne that affects teenagers, some young adults, and then there's also mechanical acne, which is from chronic rubbing against the skin, and this happens with a lot of our athletes, so including chin straps and helmets, and also the masks that I think we all, so during the pandemic, I think we all experienced a little bit of maskne, right? And then when a dermatologist examines a patient, in terms of tips, we have to first think about, like, what what type of acne does somebody have. And so by looking at somebody's skin, the two main categories of acne that we see are what we call comedonal acne versus or inflammatory acne. So comedonal acne includes whiteheads or blackheads, and that type of acne is usually a whitehead is either like a skin colored or a white small bump that is a clog pore, and a blackhead is a small, I mean, we've probably all seen these on our skin, but it's basically just the accumulation of oil at the bottom of a hair follicle, and that oil actually reacts to the air and it oxidizes, and that imparts that black color. So it's kind of an acne misconception that it's actually dirt. It's not true. And so that's comedonal acne. Okay. And that's different than inflammatory acne. These comedones over time, these blackheads and whiteheads can become inflamed, and they can turn into red bumps or pus bumps or even those deep painful nodules, and that's what we call inflammatory acne. And so to think about it, I think as just, as a parent or as a person experiencing acne, it's good to think about what type of acne that you have, because our tips are geared towards those different types. Right. So tip number one would definitely be to establish a good skincare routine. And a good skincare routine is going to be, as Sophie had mentioned with eczema, one that is going to be tolerated by your teenager, because consistency is actually really important for treatment of acne. There's some pretty good data that with whatever type of acne that you have, consistent washing is really important. So we usually recommend that teenagers wash their face twice a day. I often recommend a gentle or hydrating cleanser in the morning time, and then in the evening time with the shower, a medicated cleanser. So and this is where we come back into the comedonal versus inflammatory. If your predominant bump on the face is a comedone, then think about using some of the acid cleansers. So this includes like salicylic acid. If your teenager has more sensitive skin, you may want to consider a glycolic acid wash, or one that has lactic acid. And what's nice about these washes is they can be used not only on the face but also on the chest and back, because our patients, wherever we have these pilosebaceous units, which is everywhere on the skin except for the hands and the feet, you can actually develop acne. And there are these pilosebaceous units are more heavily concentrated on the face, the scalp, chest and the back. And so what's nice about these treatments is because the pathogenesis is the same no matter where your acne is, the treatments are typically the same for where the acne is on the body. So tip number one, washing. So we talked about comedonal and the use of acids. If you have more of an inflammatory type of acne, then I usually recommend benzoyl peroxide as the active ingredient. And this is what you can look out for on the ingredient label. There are all sorts of percentages. I usually recommend a 2 to 5% benzoyl peroxide. The traditional 10% benzoyl peroxide products can be more drying and irritating to the skin. And no matter what percentage of benzoyl peroxide, they can still bleach your clothes and the towels at home if you're not properly rinsing the benzoyl peroxide.
That's good to know.
It's very good to know, and I think something that surprises a lot of our teenagers and their parents. Some other tips. So if we are using makeup, moisturizers, or sunscreen, you really want to reach for one that says non-comedogenic or non-pore clogging, because we really don't want to be putting things on our face that can essentially lead to more breakouts. So look for that key term of non-comedogenic. Some other good ingredients to look for in products include moisturizers that have ceramides in them. So ceramides are naturally anti-inflammatory, and they can also help to reduce bacteria on the skin. Sunscreen is really important, and that is always important for patients who have acne and patients who do not have acne. Sunscreen, the sunscreen will help prevent acne scarring from getting potentially worse. And there are some great moisturizers on the market that are oil-free, are non-comedogenic, and also have sunscreen in it. The best ingredients to look out for our listeners are zinc oxide or titanium dioxide, which are the mineral-based sunscreens. And remember that sunscreen only lasts about 2 to 3 hours when you're outdoors. So whatever you put on in the morning time, by midday is not really working. Some other at-home tricks are, you may have seen those pimple patches.
Yes. Those are so popular now.
They're very popular.
They have fun shapes.
They have logos on top of them.
They're fun.
And they are actually a modified hydrocolloid bandage. And so they can help heal a pimple and more quickly. They can help actually expel that whitehead. And then another nice piece of those hydrocolloids is they keep our fingers off of the pimples, right? So a big piece of worsening acne is the tendency to pick at pimples, which can scar for the skin, and then also introduce new bacteria. We have a lot of bacteria underneath our nails, and so you can cause acne to become secondarily infected with the touching of the acne. Another ingredient that I often will tell my patients to look out for on the market is something that has a retinoid in it. So there are some prescription retinoids, and now there is one over the counter that's called adapalene. And what retinoids do is that they slowly peel away the layers of the skin and help to release those clogged blackheads or whiteheads. And adapalene is a very effective treatment. It just can be very irritating and drying, especially in more sensitive skin. So a good tip that we'll offer our patients is, instead of using it every single night, like maybe you would just start out using it once or twice and then increasing as tolerated.
That's so helpful. I think it's nice to have some concrete things that you can say, I know how much, what percentage to use for this. It's fascinating. What, clinically, you've tried a lot of different things. What can be done clinically when some of those at-home treatments don't work?
Yeah, good question. So, one thing to really reiterate to our teenagers is that it takes some time for all of these treatments to work. So whether it's an over-the-counter intervention for acne or one that is started by your dermatologist, it takes usually about 2 to 3 months to see improvement, and so patience is really important. But when your child is not responding after that expected time frame, it is worth considering coming in for treatment. Some other reasons to seek treatment for your acne are if your child is between the ages of 1 and 7. We talked about the different ages of acne, but it's a little unusual to have acne, and there might be an underlying hormonal or other cause for acne. And there are also some mimickers of acne that look like acne clinically, but something might not be quite right about it. The distribution might not be right. It's really not responding to treatment. And if that's the case, really bring it up with your pediatrician and ask to be seen by a dermatologist.
That's really helpful.
And Jen, when you also put scarring in there, I always feel like if you feel like you see scarring with acne, it's like, don't stop it. Go past go straight to the dermatologist. Don't feel like you need to do a couple of months of the really great first steps you mentioned for over the counter. Yeah.
That's really good to know.
Because scarring is very difficult to reverse and treat and can last a lifetime, really.
Right.
And is one of the reasons that in clinic, if you were to come in to have treatment, we're sometimes a little bit more aggressive about what we suggest when we see substantial scarring on a patient's skin.
That makes a lot of sense. I want to get to, I know we have about 10 minutes left, I believe. I wanted to get to some questions that were submitted by folks ahead of this YouTube Live. So the first one I have is from a parent. I believe it says, is there any way to safely get rid of blackheads, especially when they cover the nose without manually squeezing them out? They seem to be what become painful pimples. It's so tempting, right, to just want to remove them with your hands.
And the struggle with blackheads is that even if you've attempted to squeeze one at home, it will keep coming back, right? Because as we talked about, this is oxidized oil at the bottom of your hair follicle, the bottom of your pore. And we cannot eliminate our pores or destroy them, nor do we want to, because remember, they're there to help moisturize our skin. So, it really comes down to using products consistently and over time that will help to reduce the oil production and minimize the size of the pore, which helps with the appearance of the blackhead. So I really like to employ the use of one of the acids that we talked about. So a wash that either has salicylic acid, glycolic acid, or lactic acid can be very helpful in using this again consistently, because this is not something that it's a one-time thing and the blackhead goes away. It really takes months of using these products. And in addition to that acid, using a retinoid. So we had mentioned that adapalene. There are stronger topical retinoids that can be prescribed by your dermatologist, and this comes in the form of tretinoin or Retin-A, which a lot of folks are familiar with. And using this over time will help to peel away the dead layers of skin so that less oil accumulates in the pores to produce the blackhead. There are also some physical modalities that can be done, like extractions can actually be performed by your dermatologist, not at home. We don't encourage at-home extractions because they can actually result in pretty severe scarring, and especially the vacuum devices that have become popular in recent years. I've seen some ice pick scars really develop from that. So if you really need extractions, see your dermatologist. And chemical peels can also be actually very helpful at reducing oil production and helping with blackheads.
That's so helpful. Thank you. One other question, I think this is going to go to you, Sophie. Says, my child's hands get really red and almost scaly every winter. I think it's a combination of dry air and more hand washing. Since she's in school, lotions don't seem to do anything. What are your suggestions?
We're seeing this so often in clinic. Even if someone's coming in to see me for something like acne or another thing, I'm looking at their hands, and most often we see it like this dry redness, uncomfortableness on the thinner skin, the dorsal side we call it, the hands, not the palmar, which usually has nice thicker skin that's more protected, right? So this is the area that constant hand washing, the hand sanitizers that we're now using 4 years into this, can be really irritating combined with the cold weather. So going back to thinking about things you can do at home that we talked about, things like if we're doing a lighter weight lotion, maybe trying something thicker if we can at night. Some people, if your child's able to do this, like even thinking about covering with gloves for a few minutes, wrapping it. Talked about bleach baths for just eczema in general. I like bleach soaks. You can take a basin, put a gallon of water in it, and then half a teaspoon of bleach. Soak the hands a couple of times a week, and that can just help with the irritation there. Another thing I should have mentioned earlier is Jen was talking about starting with those some lines like the adapalene over the counter. There is a lower strength topical steroid, hydrocortisone, 0.5 or 1% that's available over the counter without a prescription. So that could be something that you could also try. Thicker moisturizers, bleach baths, that bleach soaks, the hydrocortisone, and then seeing the pediatrician if it doesn't improve.
So helpful. This one I'm also interested in just personally, but there's so many anti-acne, wrinkle, redness, dryness products aggressively marketed, through media outlets, including social media, which is, of course, the main way so many people are getting this information. How do we, as parents, assess ingredients and help teens navigate away from products not appropriate or safe for their developing bodies?
This is such a good question. I'm very glad that this was brought up, because I think there's multiple points to be made here in this question. First is the interest that our teens and our preteens have in taking care of their skin is a great time for parents, I think, to really engage and teach healthy habits, right? So this is a great time to really talk about establishing a skincare routine, especially with washing regularly, using a moisturizer and a sunscreen. So we really should capitalize on the interest that our kids have. But at the same time, we have to point out to them that adult skin is not the same as preteen and teenage skin. And a lot of the ingredients that are in the products that are being marketed to teenagers and preteens today are anti-aging, and there are not really appropriate uses for acne-prone skin or teenage skin, and it could potentially even make their skin more, can damage or irritate their skin. And so I think that really stressing, and this is also a great time that we can teach our kids how to read labels, right? So we want to look for those healthy ingredients that will help their acne. And if they are in some of these some of the products that they're interested in, they may not necessarily be harmful, but we want to look for the salicylic acid, glycolic acid, lactic acid. Another good ingredient that's found in some of these fancier products is niacinamide, which is a B vitamin that's also calming and anti-inflammatory. Sulfur-based products are also really good. But a lot of these many of the products also have fragrances in them. They have essential oils in them. They have dyes in them. And these are things that have really no place in the care of acne or eczema-prone skin. And so I think really like sitting down with your children and starting to teach them about what is a good ingredient and what is a potentially harmful ingredient. This is a great time, I think, for parents to to establish a safe and healthy skincare routine.
That's so, it's so interesting too, because it's not necessarily they're all dangerous, but some of them just aren't going to be effective for that kid. So it makes a lot of sense.
Yeah, and you don't have to spend a lot of money on a good skincare routine. And I think we talk about this a lot in clinic, that the healthy ingredients can be found in products that you can find in a drugstore or in a routine grocery store. And while I think that there's a bit of peer pressure to use these fancier products, I think if you really show that there are healthy ingredients, that are healthy alternatives, and I think that if there is, if your child really insists on using one of these healthier brands, follow the rules of number one, look for the ingredients that will be helpful, avoid the ingredients that will be harmful, and just emphasize that consistency is really the key no matter what.
Consistency is key. I think we're going to do one more question, just as time allows. We got quite a few questions about Accutane specifically, as a safe treatment option for acne, and just wanted to get your thoughts on that.
Yes, and Sophie, feel free to join in, but I think in the right patient population, isotretinoin or Accutane is an absolutely safe and effective treatment. It's probably the best treatment that we have for nodulocystic or severe acne that leaves scarring. We also use it a lot in patients who may not have cystic acne, but in patients that we can't wean off of oral antibiotics and other treatments that you can't be on long term. And while there are certainly side effects of any oral therapy, it really is about weighing the risks and benefits and what is best for your child in terms of whether or not they have any sorts of contraindications. Accutane or isotretinoin does have side effects. It's certainly the common ones that we see are dry skin, photosensitivity, flaring of eczema, but there are also more severe side effects that can be associated with it. It has been associated with severe birth defects, as well as possible change in liver function and triglyceride function. There's a debatable link to depression as well as inflammatory bowel disease that I know a lot of parents are very aware of. And so those side effects are concerning to hear when you're a parent or you're a teenager, but I think that in the right in the right patient population and as managed appropriately by a dermatologist, this can be a very effective and sometimes necessary treatment.
And I also just want to add, because I've seen a lot of patients with this, and knowing the great stresses that everyone's under now, having depression and having anxiety isn't going to be a reason for us to say, no, you can't be on Accutane, isotretinoin, because often we know the stress from having this severe acne is contributing to that.
Right.
It's more, we often work in conjunction with somebody's primary care doctor, their therapist, and we make sure that someone is stable before we start, has great resources, has folks to talk to about it, and that while you're on Accutane, we're going to be seeing you every month. So even if you're not also managing mental health concerns, we're going to be checking in to see how you're doing, managing the dose, going as slow as we need to manage those side effects. So I think it's a very safe medication that's very closely monitored while you're on it.
Absolutely. Do you have any sort of parting words you want to say to parents before we go?
Bleach baths.
Bleach baths.
Bleach baths.
I think with eczema and with acne, that really consistency is the key. None of these treatments are going to work overnight, and we really, I think, have to teach our kids to get into healthy skin routines, and we have the opportunity to do that not only as dermatologists but also as parents.
Awesome.
And flares are going to happen.
Yes.
It's going to be up and down. It may come back.
It will be a roller coaster.
Yeah.
Whether you're dealing with acne or eczema.
Absolutely. Well, thank you both so much. It's been really such an amazing conversation, so informative. I'm sure people have really gotten a lot out of it. I know I have. For any more information, you can check out the Answers blog at Boston Children's, and this will be on our YouTube channel for you to check out at a later date. Thank you.